Hello, good afternoon, everybody. I'm Dr. Ramanjeet Singh. I'm consultant Medanta Hospital, Gurgaon, and I'm director Dermco Skincare Clinic, Gurgaon. Today, I would like to share few of my findings regarding fungal infections. Fungal infections is highly rampant these days. This is mainly because of our lifestyle, our standard of living, our hygiene conditions. It is related to the climatic conditions and whatnot, so not and so far. Fungus is caused because of the prevailing invading fungus, which erodes our skin, which captures our skin and it captures our nails and hair also. So fungal infection, when it comes to the skin, it causes a lot of irritation, lot of redness, lot of maceration, and lot of other complications. When it comes to hair, it causes hair shedding, thinning of hair, and the hair may become brittle and leading to alopecia. If it invades nails, it can cause shedding of nails. It can cause some amount of discoloration of nails, and thereby leading to further erosion and shedding of the nails as well. Now, coming to the signs and symptoms of fungal infections, when it when it invades the skin, there may be redness, there may be papules and pustules on the skin. The patient would experience immense itching in the area, and he would have a feeling of wetness and moistness. The areas predominantly covered on the skin are where there is more exposure to sweat, like intertriginous areas. Then it may also cover the areas like groins. It may cover the areas in the axilla, and when it covers hair shedding and hair thinning is a very common noticeable effect of fungal infection. So, how do we diagnose fungal infections? To diagnose fungal infections, we have a very fine test which is done by dermatologists. This test is called a smear test, where we have a scraping of the fungus. We put it on the slide and we see through the microscope. We find fungal hyphae in the smear, which is a confirmatory test. There are various types of fungus when it comes to the skin. The various forms of fungal infections which invade the skin include candida. It may also include epidermatophytes. It may include microsporangia, and it may also include uh, trichophytons. These fungal infections vary according to their type and according to the. Okay. Now coming to the treatment of the fungus, various treatments have been prescribed in the form of creams, ointments, lotions. For scalp, we have different scalp shampoos. We have different nail lacquers, and we have nail paints for the nail fungus. So, in addition to all these, we have oral medicines, oral antifungals, like in the form of fluconazole, itraconazole, to name a few. For skin fungal infections, we have to treat the patient for about, say, 6 to 8 weeks. And when it comes to the nail fungal infection, the treatment is much more prolonged, which goes even up to 1 to 1.5 years. This superficial fungal infections is highly different from deep fungal infections. Superficial fungal infection cannot go into the deeper areas of the skin, but however, if there is some amount of trauma, then the fungus can travel up to the deeper areas. Like it can go up to the hair root, it can go up to the skin base, it can also travel through blood. It can also be a bloodborne giving to deep fungal infections. Now, there are different methods of preventing. Commonly, in a proper hygiene, we change our socks every day, and we expose them to washing, and we expose them to ultraviolet rays of the sun. Then we can definitely get rid of the fungus. Similarly, coming to nails, if there is a patient has a tendency of nail infection, we ask the patient not to wash his hands very frequently, and ask them to keep a good hand hygiene. So keeping all these things in mind, we can definitely prevent fungal infections. Apart from that, on fungal infections on the intertriginous areas like groins and axilla, they can also be taken care of by keeping good moisturizing, using good moisturizers and also coconut oil, which also again helps in preventing growth of the infected skin.